Even if you're not a healthcare professional, you've very likely heard of the Hippocratic Oath, and what you know about it can likely be summed up thusly. Newly minted doctors take an oath to do no harm, to help their patients, and perform their duties to the best of their ability, among other things. But what is this oath exactly? Is it just a myth? Is it something doctors used to do, but no longer swear to? Was it really something Hippocrates came up with? And is it legally binding? Today on the Medical Humanities Break, we'll find out a bit more about the Hippocratic Oath. The Hippocratic Oath is the earliest example of the concept of medical ethics. It was written in Ionic Greek between the 5th and 3rd centuries BCE, and it's commonly attributed to Hippocrates, the Greek physician often called the father of medicine. Some modern scholars now doubt that he actually wrote it, but there's little evidence either way. Here's the original oath, translated into English by W.H.S. Jones in 1926. I swear by Apollo healer, by Asclepius, by Hygeia, by Panacea, and by all the gods and goddesses, making them my witnesses, that I will carry out, according to my ability and judgment, this oath and this indenture. To hold my teacher in this art equal to my own parents, to make him partner in my livelihood. When he is in need of money, to share mine with him, to consider his family as my own brothers, and to teach them this art, if they want to learn it, without fee or indenture, to impart precept, oral instruction, and all other instruction to my own sons, the sons of my teacher, and to indentured pupils who have taken the healer's oath, but to nobody else. I will use those dietary regimens which will benefit my patients, according to my greatest ability and judgment, and I will do no harm or injustice to them. Neither will I administer a poison to anybody when asked to do so, nor will I suggest such a course. Similarly, I will not give to a woman a pessary to cause abortion, but I will keep pure and holy both my life and my art. I will not use the knife, not even, verily, on sufferers from stone, but I will give place to such as are craftsmen therein. Into whatsoever houses I will enter to help the sick, and I will abstain from all intentional wrongdoing and harm, especially from abusing the bodies of man or woman, bond or free. And whatsoever I shall see or hear in the course of my profession, as well as outside my profession, in my intercourse with men, if it be what should not be published abroad, I will never divulge, holding such things to be holy secrets. Now if I carry out this oath and break it not, may I gain forever reputation among all men for my life and for my art. But if I break it and forswear myself, may the opposite befall me. The oath was not a standalone document. It formed part of the Hippocratic Corpus, a collection of around 60 medical works attributed to Hippocrates, although its authorship is a matter of debate. The works in the corpus addressed not only the treatment of various diseases, but also the art of medicine and the ethical considerations of medical practice. Writer Susan Wise Bauer notes that as the first medical treatise that did not, quote, blame or invoke the gods for disease, it is the, quote, first surviving book of science. It was, however, as the first line demonstrates, a pledge sworn to the Greek gods of healing, Apollo, Asclepius, Hygeia, and Panacea. The last two is where we get the words hygiene and panacea. And so in 1964, a more secular, modernized oath was rewritten by a Tufts University Dean of Medicine, a doctor by the wonderful name of Louis Lasagna. This version of the oath is still in use today by many U.S. medical schools. Here's Dr. Lasagna's version. I swear to fulfill, to the best of my ability and judgment, this covenant. I will respect the hard-won scientific gains of those physicians in whose steps I walk, and gladly share such knowledge as is mine with those who are to follow. I will apply, for the benefit of the sick, all measures that are required, avoiding those twin traps of over-treatment and therapeutic nihilism. I will remember that there is art to medicine as well as science, and that warmth, sympathy, and understanding may outweigh the surgeon's knife or the chemist's drug. I will not be ashamed to say I know not, nor will I fail to call in my colleagues when the skills of another are needed for a patient's recovery. I will respect the privacy of my patients, for their problems are not disclosed to me that the world may know. Most especially must I tread with care in matters of life and death. If it is given to me to save a life, and save life wherever possible within reason, this awesome responsibility must be faced with great humbleness and awareness of my own frailty. Above all, I must not play at God. I will remember that I do not treat a fever chart, a cancerous growth, but a sick human being, whose illness may affect the person's family and economic stability. My responsibility includes those related problems, if I am to care adequately for the sick. I will prevent disease wherever I can, for prevention is preferable to cure. I will remember that I remain a member of society, with special obligations to all my fellow human beings, those sound of mind and body, as well as the infirm. If I do not violate this oath, may I enjoy life and art, respected while I live and remembered with affection thereafter. May I always act so as to preserve the finest traditions of my calling, and may I long experience the joy of healing those who seek my help. There is, unfortunately, no consistency in the use of the oath among medical schools. Some schools use the original oath, some use Dr. Lasagne's version, some use the Declaration of Geneva, which is a more concise version of the oath, and some use the Oath of Maimonides, which also expresses many of the same basic tenets of a physician's ethics. The reason for the existence of so many different oaths comes down to controversial interpretations. The concept of first do no harm, primum non nocere in Latin, which, by the way, was a 17th century addition to the oath, has led many to believe that doctors should not provide abortions or assist with euthanasia. Utmost respect for human life from its beginning, which appears in some modern versions, can be interpreted as being a staunch admonition against abortion. And the line, "I will not give to a woman a pessary to cause abortion," is certainly patently clear on the subject. However, scholars have pointed out that the original oath also prohibits the use of a knife, i.e. surgery, even though the corpus contains detailed guidance for performing surgery. Some speculate that several different authors over many centuries contributed to the oath and brought each of their unique values to it over time, some of which contradicted others. Another theory posits that the original oath was meant to protect patients from unscrupulous doctors only, as it was commonly feared that doctors could become paid assassins. Seen through this lens, all the prohibitions and ethical considerations presented in the oath could be seen as criminal acts if perpetrated by someone else against the patient to cause harm. Doctors should not be accessories to crime, in other words, and should remember that they work for the patient and no one else. And finally, is the oath legally binding? Strictly speaking, no, not in the modern era. In antiquity, breaking the oath could result in penalties or the loss of a doctor's right to practice medicine. These days, however, it's more of a symbolic oath than a set of practice guidelines, and has been replaced by comprehensive codes of ethics produced and regularly updated by various national medical associations. The consequences of violating ethical principles is largely still the same, however, and if a physician violates their association's specific codes, they face disciplinary action and possible suspension or revocation of their license to practice. The spirit of the original oath persists, in other words, whether pledging one's life as a practitioner of the art of medicine to the Greek gods, or following the guidelines spelled out in a modern code of ethics. I'm sure Apollo Asclepius, Hygeia, and Panacea would be quite pleased. That's it for now. Join me next time for another Medical Humanities Break.